Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. A very good afternoon to all. Welcome to the Fireside Chat of the Special Ministerial Conference for the ASEAN Digital Public Health with its theme, Collaborate for a Happier and Healthier World Post-Pandemic. Hi, I'm Haji Rozaidah, and I will be co-moderating for today's Fireside Chat. And here with me is...
Hello, everyone. I'm Kevin. Yes, Rozaidah. So for today's Fireside Chat, I'm personally really looking forward to hearing from our very distinguished guests around Brunei Darussalam healthcare digital transformation.
So our guest speakers today, Kevin, will be sharing their experience, their insights on the digital healthcare transformation in Brunei, including the use of BruHealth. BruHealth, for the international audience out there, BruHealth is a health artificial intelligence and big data app, which has helped Brunei manage the COVID pandemic situation in the country.
And aside from that, really the app, what we actually look at is really the ongoing surveillance of emerging diseases, so that really to ensure that we are actually well ready for the next pandemic. Personally, I've learned a lot from earlier session around how do we prepare for disease X and how to empower our population across entire Brunei around accessing healthcare from their fingertips.
So Kevin, shall we introduce our prominent speakers for today? We'll start with Tuan Haji Khairuddin bin Haji Abdul Hamid, the Permanent Secretary for Investment at the Ministry of Finance and Economy. Welcome, Tuan Haji.
And next up, is a gentleman that I got to know very dearly, got to know very well over the last year, Mr. Maswadi Mohsin. He is the Permanent Secretary of Ministry of Health, Brunei Darussalam.
And our third speaker for today is Yang Mulia Tuan Haji Muhammad Nazri bin Haji Muhammad Yusuf, Permanent Secretary for the Ministry of Transportation and Info Communications. Welcome, Tuan Haji, Mr. Permanent Secretary, to our Fireside Chat session today. Welcome.
Great. So as we talk about, Brunei's healthcare digital transformation journey, let's dive straight in to Mr. Maswadi, who is actually, his ministry has been in the center of all these actions. So Mr. Maswadi, tell us a little bit more about, Brunei Darussalam's healthcare digital transformation journey, please.
Thank you, Kevin. Bismillahirrahmanirrahim. Just a short note of how our healthcare digital transformation journey started. In less than a decade ago, His Majesty Sultan of Brunei launched what we call Brunei Health Information Management System, which we call it in short BruHIMS. I would say that was the next big transformation happened because of COVID. A huge support from Ministry of Finance and Economy and from Ministry of Transport and Info Communication, which actually helped us create what we call the BruHIMS, BruHealth. Brunei Health Information System Management System, commonly known as BruHIMS, is a centralized system where patient records information can be retrieved by individual unique numbers from any health facilities across Brunei. The health system integrates, manage, and patient's information electronically to meet goals of one patient, one record. I'm proud to say now Brunei, almost 100% of the population is in BruHIMS. When COVID hits Brunei in 2020, we understand very quickly the needs to leverage on technology or to better protect our people and better serve our people. In the midst of the pandemic, as we know, Brunei having a very small population, technology will be our best solution to help us manage the situation. Working closely with EVYD, my dear friend here, we rapidly launched a series of tools and dashboards to enable a real-time visibility and traceability so that resources can be more optimally managed and target measure can be taken to bring the situation under control quickly. Last year, within a month, we managed to stop the all community transmission. One of the most important tools launched was BruHealth, our national health app for all with collaboration amongst multiple ministries for its data sources. Not only that we are able to enforce control and closed-loop contact tracing all positive cases via BruHealth, we were also able to implement dynamic population management to help our local businesses to operate safely for resident Brunei to go through with their lives in the midst of the peace of mind. The most recognizable is the health coding, in which individual person is coded with color, purple, blue, yellow, and green, which respectively means that a person with a purple code is a positive COVID, blue is a recovered patient, yellow is a medium risk patient, and green is a healthy person. During those times, only green and yellow were able to go to facilities like mosque and shops. For the last 15 months, when Brunei had no community cases, we did not rest as well. We continued to invest in our next generation public health infrastructure and launched the public health surveillance platform in October 2020. The platform extracts relevant data in real time with BruHIMS, as well as patient self-reported data, use natural languages processing and machine learning models to identify emerging threats of all over the 30 non-infectious disease and potentially new infectious disease. When the second wave started, we were able to leverage BruHealth again to augment any health capacity without significant increasing workforce. For example, we had been issuing digital quarantine orders to all close contacts and confirmed cases, automatically calculate the swab tests and end dates. It also helped assess the requirement for additional ventilators, hospital beds, medical gases, and even to the point of helping assess records for food delivery to the quarantine people and continuously monitor patient report symptoms. As soon, we'll be rolling out home isolation and confirmed cases, similar modules, expanding our coverage using existing infrastructure. Today, BruHealth is not just a contact tracing app. It supports vaccination certificates to allow travelers moving on with their lives, online appointment, video consultation, and entire vaccination journey to all our residents in Brunei. Now, everyone in Brunei knows BruHealth, either children in kindergarten, senior citizen, or whoever, or even foreigners.
Thank you, Tuan Haji Maswadi. Despite the challenges that we faced, alhamdulillah, we pulled through. I remember when we first launched on the 7th of May, 2020, it was quite a challenge to get people to understand the importance of BruHealth. But alhamdulillah, after that, I mean, now when you go anywhere, you can't enter a premise without having to scan the BruHealth QR code. This is critical for contact tracing. But besides that, what's most important here is that we've seen how BruHealth has grown, has become an important tool for Bruneians for anything, almost everything related to health. So Kevin, I'm actually really excited to see how BruHealth version 3.0 will elevate a patient's healthcare experience. So moving on to the next question. Well, ladies and gentlemen, in Brunei, we go by the saying, when we do something, we should do it together. It's a whole of nation approach. Just to share with you the history of BruHealth, one of the ministries working closely with Minister of Health in the development of BruHealth is Ministry of Finance and Economy. For the next question, I would like to invite Tuan Haji Khairuddin to elaborate further on how does Ministry of Finance and Economy play a part in this BruHealth journey.
Thank you, Rozaidah. Bismillahirrahmanirrahim. I think everyone can agree that, with COVID-19, it changes the way we view the importance of public health. And I wasn't sure that everybody can understand that we are still sitting here talking about COVID-19 since 22 months ago when it started. And we are, I would say, facing the full brunt of this pandemic now because I think we've done so well last year. but with this new variant, it has provided us with some challenges. But nonetheless, I think everybody agrees that COVID-19 sort of accelerated the digital transformation for Brunei Darussalam. And from MOFI's perspective, we always believe in investing wisely in our people for the long term, as from every aspect, from be it for education, healthcare, social welfare, infrastructure, and other economic activities. I mean, just to explain, the government of His Majesty, through MOFI, invests in and funds various initiatives to several channels. One of it is via the annual fiscal budget, which is dispersed to ministries for their various requirements, which also include digitizing their services and operations. And the other channel will be through the development fund, the RKN, which is funding any infrastructure investment. And the last channel would be the various portfolio funds that MOFI operates, including Brunei Investment Agency, Minister of Finance Cooperation, and Strategic Development Capital. So when the pandemic hits, a dedicated budget was quickly set aside for the pandemic response. And a significant portion of that was allocated to actually secure medical resources to ensure that we have adequate capacity. But we also made conscious decision to allocate funding for investment in technology to ensure that we are able to contain this pandemic at that time and in the long term. So we were swiftly looking through our sovereign wealth fund, BIA, to source an ideal solution among the various investee companies in BIA. And within the first week of the outbreak, we were funding a project which we engaged a team now consisting of EVYD Technology to develop a pandemic response system. With the success demonstrated in the first month, additional funding was approved to develop the BruHealth app and a public health surveillance system, as mentioned by my colleague Tuan Najib Maswadi, with the goal to develop an infrastructure not just for the time being, but also to prepare us for the next pandemic. So what initially started as a contact tracing app, now we can get healthcare services through BruHealth. We are able to look into our pocket that we have our health record displayed on there, and we can manage essentially our health on the go. So MOFI will try its best to support the vision that our colleagues at the Ministry of Health has in terms of making sure that everybody's health is taken care of, and that means not just investing in healthcare, but infrastructure, but also in infrastructure that makes our healthcare digital transformation possible. So I would like to cite other investment that are made by Ministry of Finance and Economy in terms of enabling digital healthcare to be possible. These are things like the NETCO project that is to invest in a world-class and affordable connectivity and IT infrastructure services. And then we also have investment in various GLCs to invest in IT capabilities and services, such as Dynamic Technology, UNN, DST, Imagine, and Progressive. This is to ensure that talents and skills are developed and retained in country. And of course, we have a program to develop and invest in our GLC that they are able to provide to digitalize their operation and services. Thank you.
Thank you, Mr. Khairuddin. I think everyone can agree that having your personal medical record in your pocket on the go is definitely a game changer. It changed how the way people view their own personal healthcare data. And I think from a nation's perspective as well, more importantly, like what Mr. Khairuddin mentioned, MOFI is not just investing in healthcare, but also the infrastructure and many other enablers to help the digital transform to make the digital transformation journey possible. So I think the next question goes to Mr. Najri. How do you see healthcare as a sector contribute to the Smart Nation initiative led by your ministry?
Thank you, Kevin. Bismillahirrahmanirrahim. My previous two colleagues here has shared how what we are experiencing now has accelerated our transformation. In this particular case, the healthcare. From the perspective of the Digital Economy Master Plan, for everyone's knowledge, it was launched in June 2020. We have a focus on developing a smart nation through digital transformation. Within the master plan, we have identified 9 focus sectors, among others, food, finance, education, and of course, why we are here today, healthcare. My colleague from MOH just now mentioned our healthcare sector is no stranger to the use of technology. Way back in 2012, when BruHealth was adopted, the concept of one patient, one record was successfully implemented with, I believe, up till now, 90% of the total population have their medical records. This implementation of BruHealth has provided what we call efficiency gains, portability of medical records. It is also important here to recognize that BruHealth has successfully allowed us to improve delivery of existing healthcare, but perhaps not so much on the provision of new healthcare services. What I meant by this is that until recently, technology hasn't allowed us to revisit and ask ourselves a few key questions. First, what kind of insights can we get from all this digital data and patient records? Second, what kind of decisions can we now make about patient healthcare? Third, what kind of decisions can now we make about population health management? And of course, fourth, what kind of patterns can we spot to identify future pandemics? These are the kinds of questions that we all need to ask under the Digital Economy Master Plan. The advent of technologies such as artificial intelligence, big data, blockchain, IoTs, Internet of Things, and automation has opened a whole world out there of new dimensions that is not available before, like we experience now with BruHealth in Brunei. This is a challenge that we need to tackle. And with respect to digital economy and the smart nation, there are a number of questions such as what kind of new services can and we should provide? What can we do fundamentally to transform the way we do things? And thirdly, what can we do to further empower individuals in the digital age? Of course, as everyone knows, COVID-19 pandemic has greatly accelerated the initiatives in the healthcare sector dramatically. The development of big data and artificial intelligence was one of the tools we use in being able to address this pandemic. As such, the sector now holds a lot of lessons that we can learn from to transform our other sectors moving forward. So we are keenly watching the space and hope to get many more great examples that we can showcase to our other sectors of the potential of digital transformation. At the same time, we are also focused on filling in the underlying infrastructure that will also support the ministry in its transformation. For example, we are looking to further enhance our digital ID offerings, which I'll talk a bit more later on, so that individuals can easily register for health services. Improving overall data protection is another area, which is to ensure safety and security of personal information. We are also exploring and implementing other technologies such as blockchain that may become useful within health contexts, such as its use for securing personal health records or potentially as a vaccination passport. Thank you.
Thank you, Haji Nazri. We can see that with the advent of new technologies, such as artificial intelligence and big data, blockchain you mentioned earlier, as well as ubiquity of Internet of Things, IoT, and automation have opened up new dimensions that were not available for us before this. So it's going to be interesting, exciting to see how Brunei society also advances with the new technology. So this brings me to the next question for Tuan Haji Maswadi, the Permanent Secretary for Ministry of Health. Tuan Haji Maswadi, could you please share with us your views on what is the future for digital healthcare transformation for Brunei?
Thank you, Rozaidah. In line with the Wawasan 2035 or Brunei Vision 2025, Ministry of Health actually also developed our own Brunei Health Vision 2025, which aims to achieve people-centered, value-based healthcare system supported by robust research and the digital health ecosystem. The Smart Health Plan developed in line with the strategic plans of our strategic plans 2019-2035, which encapsulates our immediate strategies for achieving the national vision. The Ministry of Health plans to extend beyond healthcare in clinical setting, which includes prevention and control of disease as well as protection of public health at large. Smart Health focus on supporting preventative efforts and measures through collection and collaboration of huge amount of data using big data analytics, and analyze and interprets as it trends, forecasts, and early warning to the Ministry of Health to be used as reference and decision making and policy and strategies in the future. Smart Health also capitalize beyond the mobile devices application. Things like mobile devices, contactless devices, IoTs, audio and video devices, which will enhance public engagement, at the same time simplifying process of patients management. Implementing Smart Health, Ministry of Health focus on 7 initiatives. The first is establishing health data standards in which we ensure the interoperability of data and ease of data exchange between departments, between ministries, and between healthcare providers. Strengthening the healthcare information system by introducing new technologies to realize digital transformation in the healthcare sector and embrace the use of Industrial Revolution 4.0. Strengthening collaboration with private health institutions to achieve holistic people-centered healthcare agendas, in which this is trying to achieve the one patient, one record, which we currently use in Ministry of Health, but we have not been able to capture the data of health from the private clinics and healthcare hospitals. Empowering the community by providing them with ease available tools to increase healthcare awareness amongst the population, continuously monitor their well-being themselves, cultivate a sense of responsibility for their own health and public health. And BruHealth application will complement with BruHIMS. Fostering data analytics culture, which strategize and policy made based on the interpretation and application of data patterns. Telehealth and telemedicine, and the last one is digitalization of our admin operation. BruHealth is an extended platform of an essential part of our digital transformation roadmap. Our national big data platform enables us to unlock the potential of health data in developing a vibrant search ecosystem to support the evidence-based decision-making process that could be implemented in both patients' journey and clinical workflow. Other than the basic essential, like making an online appointments, video consultation, queue system on BruHealth apps, we are also introducing health management programs, including digital therapeutics for diabetes and lifestyle health program like STEPS challenge, physical activities challenge, that will nudge our people in healthier lifestyle. And ultimately, we bring such initiative will drive improved patient satisfaction and overall better health outcomes. This is not just for the patients. Earlier, we talked about the augmenting our healthcare capacity. We want to be able to support more and high quality research providers to value inside the support of evidence-based clinical decision and patient management, which enable quicker intervention and improve patient treatments. As the saying goes, it would take a village to raise a child. in our digital transformation journey, MOH is glad to have the full support of the whole of nation to bring healthier society. Thank you.
Thank you, Mr. Maswadi. Picking up from the smart health plan mentioned by Mr. Maswadi earlier, we talk about leveraging the national healthcare big data platform evidence to sort of establish data standards to really unlock the potential healthcare data. And one of the things that was mentioned earlier in the panel by Dr. Justin Wong, representing Brunei, as well as Dr. Gordon Galia, representing WHO. They talk about raising healthcare equity, for everyone. And I think that's very, very important. The data interoperability and how do we make healthcare really accessible to not just the patients. I think it's also making it accessible, not making the data accessible to researchers to empower research, making it accessible for policymakers to make better policy decisions, and also fundamentally augment our healthcare capacity. We are a small nation. Brunei is a small nation. How do we leverage technology to punch bigger than our weight, right? That is very, very important. So that and that's huge effort. And I guess my next question really go to Mr. Nazri. Really wanting to know, how does the ministry, and I guess as Brunei as a whole, prepare the nation for digital transformation? Mr. Nazri.
Thank you, Kevin. I mentioned earlier about the Digital Economy Master Plan, which was launched last year. The plan outlined 4 major strategic thrusts. First is the government digitalization. This is the key driver in the ecosystem. Secondly is industry digitalization, which is the engine of the economy. I think as everyone understands it, we can't have a digital economy if our industries in the various sectors do not embrace digital technologies. Third is a thriving ICT sector, which is necessary to provide the technology and support in our development. Fourth, of course, all things considered, we must have the manpower. So we must do manpower and talent development to ensure that we have enough manpower and knowledge to utilize and deploy all the technologies. I mentioned a bit earlier just now, the Digital Economy Council is also focused in delivering some key flagship projects that are seen to be fundamental towards our transformation of the government, of the industry, and ultimately the society. I'll mention 3 here. First is digital identity, which seeks to leverage on blockchain technology to provide advanced identity services in the digital economy. Secondly, National Payment Hub, which aims to provide key infrastructure to reduce the barriers for digital transaction between various payment providers. And thirdly, the National Information Hub that is focused on facilitating information sharing across government agencies, of course, in a more secure, trusted, and seamless manner. Furthermore, we're also looking at beyond these flagship projects to look at our infrastructure offerings and, of course, the regulatory environment to support all sectors, including healthcare. To this end, the master plan has outlined several strategic enablers to address this. Some of the efforts we are using, we are trying to utilize is to implement enablers such as exploration of 5G connectivity, implementation of government super app, which will provide access to all government services. I mentioned again blockchain infrastructure, and for increasing trust in the database. From the regulatory point of perspective, we have recently established the Cybersecurity Brunei (CSB) agency that is tasked with overseeing the security of critical national information infrastructure. Additional key regulation being worked out include a robust data protection legislation that covers the use of personal data in the private sector, but also improving overall data sharing governance in the public sector as well. The preservation of security and data protection, as everyone knows, is critical in the long-term sustainability and trust in the digital economy. Lastly, I would like to add that research, development, and innovation is also a key component in driving our future change and future development as we move forward. With respect to this, I would like to highlight that the new Council for Research and Advancements of Technology and Science, CREATES, has been recently established. CREATES has been developed as a platform to promote science and technology, research and innovation, and is responsible for setting policies and plans for science, technology, again, innovation, every 5 years. The Council will also revise existing funding schemes that promote research and development in the country. This includes promoting growth of science, technology, innovation activities, as well as drive economic and social development. As you can see, both the plan, the Digital Economy Master Plan, and CREATES will work together in leading and moving us forward in terms of innovation and adoption of technology. Thank you, Kevin.
Thank you, Tuan Haji Nazri. So with Ministry of Health's Smart Health Plan and MTIC, Ministry of Transportation and Info Communications efforts in ensuring that the infrastructure and policies are in place, such as talent, regulatory and funding, funding to support digitalization and RD efforts. So when we talk about funding, the next question is perfect for Tuan Haji Khairuddin. Perhaps Tuan Haji Khairuddin can comment on how does Ministry of Finance and Economy see the value of investment in the digital healthcare transformation?
Thank you, Rozaidah. So again, just to stress that MOFI takes a long-term view when it comes to investing in any infrastructure as well as healthcare infrastructure. So, and it will be based on scalability and sustainability. So on this, we also consider adjacent benefits, so to speak, for the broader economy. So we would like to leverage this for our foreign direct investments, attraction, development of new industries, job creation, skill and knowledge transfer. As already discussed by my colleague, Tuan Haji Maswadi, our investment in BruHealth currently and during the pandemic has laid a strong foundation for the ministry to achieve their health vision, Wawasan Brunei 2035. So I would like to focus on the adjacent benefits that brought about in this particular investment. So one is for EVYD Technology to actually come up with they're already building it, a campus in Brunei that aspires to be a center of excellence for healthcare and AI, machine learning, research and development, among other things. And this campus will be also contribute to the training of data engineers to develop data and information centric economy to the wider economy. And on top of that, we are also leveraging on this to build a research ecosystem like the currently joint research between UBD, Duke, NUS, and Brunei Ministry of Health, which is a good example on how we can promote top-notch research in Brunei because of our research infrastructure. So again, sustainable financing for healthcare is also key area for us. As you are aware, healthcare in Brunei is almost fully funded by the government. And it is of paramount importance that the money that we spend is optimally spent and waste to be reduced so that we are driving a better value from our healthcare spending. So while we spend directly to healthcare, we are actually also investing in the connectivity because that is a requirement for this whole ecosystem to work. And also in terms of the capacity in data center, cloud services, via one of the GLC UNN, and And this is intended to assist the various digital agendas that were cited by my colleague Tuan Haji Nazri earlier with regards to the payment hub, the one data center, and other initiatives. So as a result, we are investing in technologies that could add objectivity directly or indirectly to healthcare in terms of evaluation, resource allocation, and diagnosis. So the key foundation of this is to have a big data platform, as mentioned by Tuan Haji Maswadi, to ensure that there is comprehensive, high quality data that can be leveraged on securely, as well as to be dependent on as a single source of truth. Another objective to promote private sector participation in the financing and provision of healthcare. Via EVYD Technology and BruHealth, we are also investing in the analysis, direct engagement, and also hopefully engage all healthcare providers onto one common platform so that everyone will have a single record despite visiting multiple healthcare providers. So hence, we are making sure that we have the prerequisite and infrastructure to encourage innovative health insurance products as well, and to develop an ecosystem of digital health providers. A centralized health data platform can enable a lowering of costs to operate this for the stakeholders. And the most important aspect of this aspiration is that the whole population of this country can access healthcare services from wherever they reside. Healthcare is provided free to the population, and as MOFI, we want to ensure that the spending is targeted, world-class, and beneficial. Thank you.
Thank you, Mr. Khairuddin. I think you raised a few good points. We at EVYD are building a campus in Brunei. We're very, very excited to be able to hopefully become a research hub. We're going to launch EVYD Knowledge Hub, and that is something that is incredibly important. And we look forward to partner all the ministries in moving Knowledge Hub forward as well. And Mr. Khairuddin earlier mentioned two great points, I think. The first one is around scalability, and the second one is around sustainability. Any digital transformation is, in my opinion, is not just a digital transformation, it's a cultural transformation, because we're so used to what we have been using, what we are doing. And any digital transformation is a marathon, it's a really long journey, it's a huge journey. So I think the next questions that I have for all our three permanent secretaries is, where do we go from here? Like, what is the paramount to Brunei's success in healthcare digital transformation? So maybe Mr. Maswadi, you want to take it first?
Thank you, Kevin. I think what is most important in the coming forward with digital transformation for healthcare is collaboration between all agencies, between the government, non-government, and then the private sector, individual, and clinicians to move forward and leverage on this technology. And for us, and as well as beyond the borders, the ASEAN nations, for us to collaborate together to create a more vibrant healthcare technology and to digitally transform our healthcare for the whole region.
Next, we would like to invite either Tuan Haji Khairuddin or Tuan Haji Nazri to say a few words before we move on to the question and answer session.
Thank you, Rozaidah. So from the perspective of MOPI, I mean, going forward, we'd like to ensure that our investment is benefiting us. So we would like to ensure that there is realistic targets and milestones that can be tracked so that both quantitative and qualitative ROIs are measured. So from again, from MOPI's perspective, we do performance, what we call performance budgeting modality in our fiscal funding. So that is something which is important to us going forward. I mean, currently and going forward in the long term. And with that, we want to ensure that we would like to scale the spending on a pace basis rather than big spending at one time. And I agree with Tuan Haji Maswadi. I mean, we need to align expectation with everybody, every stakeholder, and that means whole government approach and whole nation approach. And I think this is important. I mean, having a regulatory, a fair and cohesive regulatory environment, as mentioned by Tuan Haji Nazri, is important so that we have various checks and balances to ensure that various risks are mitigated. Because we're talking about digital infrastructure which is open to various risks. Thank you.
Thank you, Tuan Haji. And next, we'd like to invite our third speaker, Tuan Haji Nazri.
Thank you, Rozaidah. If you recall back over the last, I don't know, half an hour or so, some keywords: alignment, collaboration, the role of private sectors, the role of individuals. Well, I certainly agree that these are the keywords, key important words. Not just in Brunei, it's all in ASEAN. We are all in this together, so we all need to work together for a better future for everyone. As also mentioned before, we need to ask the right questions. What are the right questions? What new things and services does today's technology and all data analysis allow us to do? What do we now have that is obsolete? What can we do to further empower individuals in making better decisions about their health? Again, if you look at healthcare, it's not just about healthcare development per se. It's about transformation of the economy and realizing the vision of a smart nation. For example, the system provided by EVYD is not just a single implementation, but it's a long-term investment into the sector in the country. Again, the message is about maximizing impact as a whole. We need to ensure positive impact to the society as how they receive healthcare, but also the bigger picture, again, coming back to the economy and of course, the adoption of technologies. Finally, again, coming back to the message we've been saying again and again earlier, collaboration, innovation, key role of private sector, key role of the government. All of us need to work together and be aligned to create the ecosystem where the ecosystem will develop platform, regulatory framework, infrastructure, capacity building. More importantly, in a digital economy and the adoption of technology, access to devices and access to connectivity. So these are very important areas, and we need to look forward as we move to the future of smart nation. Thank you.
Thank you, Tuan Haji Nazri. No doubt, Kevin, this is a major effort that requires continuous close alignment and collaboration, the two key words across the ministries. Now, do we have time for question and answer session? Yes, shall we
I think we should be
open it
able to
up
take
for the
one
floor?
question.
Yeah, at least one question. Any question? It seems like we are short of time too. Perhaps, well, before we conclude the session, any final words from you, Kevin?
No, I'm personally very, very excited, around the digital transformation journey that Brunei is going through. I think we at EVYD are very privileged to be a part of this journey. And I think more importantly, we'd like to hear from the permanent secretaries before we leave the stage. Any words for the audience?
I think let us move together, whether the technologists or the government or the people. Digital healthcare is the way forward to manage the individual and the public as well.
Yes, Kevin, this has been a wonderful opportunity being with the 3 permanent secretaries for the Fireside Chat session. It has been an honor. Tuan Haji Maswadi, Tuan Haji Nazri, Tuan Haji Khairuddin, thank you for joining us today, enlightening us, reminding Bruneians how the journey started with the digital healthcare transformation for Brunei. And thank you, Kevin, for co-moderating for today's session. And of course, thank you to the audience out there for continue to watch the Fireside session. And of course, before we wrap it up, I would like to conclude that with the digital healthcare transformation, whichever initiative there is that is being introduced out there, whatever it is, if you want it to be effective, we have to do it together. We have to do it together as a team. You know what the saying, how the saying goes, teamwork makes the dream work. So it's a whole of nation approach. This is me reminding myself before reminding others. Let us continue to collaborate for a happier and healthier world post-pandemic. With that, I conclude with wabillahi taufiq wal hidayah. Wassalamualaikum warahmatullahi wabarakatuh. Thank you.